Is it really possible to increase penis size naturally? Guys, this video is not about miracles or false promises. What I'm going to do is show you 5 habits you can adopt to prevent penis shrinkage and, in some cases, slightly increase its visible length. I'm Dr. Girag Mihai, urologist. If you appreciate honest medical advice without lies or fake enlargements, take a second to subscribe and turn on notifications so you don't miss content that actually helps your health and confidence. Today's topic is a bit controversial: natural methods to enhance the size of the penis. Does this really exist? Before anything else, let me make one thing very clear. There are no magic solutions, and you should not trust products advertised online or across social media that claim to enlarge the penis. They don't work. However, certain habits can help improve the appearance and exposure of the penis and even prevent a reduction in its size. First point: weight loss. The penis is anchored to the pubic bone. Around this area, there is a fat pad. In overweight or obese men, excess fat in the pubic region can bury the penis, making it appear smaller, or even leading the person to believe they have penile atrophy. In reality, the penis isn't shorter, it's covered by fat. Losing weight, especially abdominal and pubic fat, can expose more of the shaft, making the penis look longer. Another option, not natural but frequently performed, is liposuction of the pubic region. Some patients, even after losing weight, still retain fat above the penis. In these cases, liposuction can be performed in a surgical setting. This allows removal of fat and reveals 2 to 3 centimeters more of the penile shaft, improving its visible size. Second method: postulectomy, circumcision. Men are born with foreskin covering the glans. In some cases, excessive skin or phimosis covers the glans entirely, making the penis look shorter. When circumcision is performed, the glans remains fully visible, giving the appearance of a longer penis. Third habit: preventing penile atrophy. Maintaining penile health is also a way of preserving or even improving size. To avoid shrinkage or weakening of the penis, regular blood flow and oxygenation are essential. This does not depend solely on sexual intercourse or masturbation. We also recommend exercises and therapies such as pelvic floor rehabilitation, treatments for erectile dysfunction, and the use of penile vacuum pumps, vacuum devices. These pumps increase blood circulation in the penis, help stretch tissues, and prevent atrophy. Over time, this helps maintain penile size and function. And it is also essential to warn patients about the absolute contraindication of injecting non-absorbable substances into the penis, such as industrial silicone or PMMA, to increase penile thickness or girth. These substances are strictly prohibited for anyone who wants to preserve healthy sexual function. They can cause severe complications and should never be used. Fourth tip: hair removal. Often, excess pubic hair at the base of the penis can create the illusion that the penis is smaller than it actually is. Instead of razors, which can cause cuts and follicle injury, it's safer to use electric trimmers or scissors. By trimming or removing hair around the base, the penis becomes more visible, giving the appearance of greater length. Fifth tip: penile traction devices, penile extenders. Have you ever heard of penile stretchers or traction devices? Let me know in the comments if you've seen, heard of, or even used them. In many cultures, especially certain African and Asian tribes, body parts such as lips or necks are lengthened over time through continuous traction. With the penis, the concept is similar. These extenders are specific medical devices designed with adjustable tension. They must be used regularly for a minimum of 6 months, and in some cases can provide a gain of 1 to 3 centimeters in length. However, they must only be used under medical supervision, as misuse can reduce blood circulation, cause tissue trauma, or even necrosis, leading to permanent damage, the exact opposite of the intended result. It's important to note that penile traction devices are not miracle solutions. They are scientifically recognized tools, often prescribed in the acute phase of Peyronie's disease, penile curvature, and also after surgical correction to help straighten the penis and prevent shortening. These devices are usually managed by a urologist, and when needed, in collaboration with a pelvic floor physiotherapist specialized in sexual rehabilitation. If you found this video helpful and believe it can help someone, please share it. Don't forget to subscribe to the channel, leave your like, comment, and activate notifications to follow our weekly content. A big hug and see you next time.
Gentlemen, if today's video helped you protect your health, your confidence, or your energy, you can now say thanks in a special way. Just click the thanks button below the video. Your support helps me share more tips that keep men strong and healthy well past 60, and I truly appreciate every single one of you.